Hey, deserving listeners. So over the past 10 or 15 years, I've been increasingly concerned with the so-called profession of coaching or life coaching. I've been concerned about this for many years, but I feel like it's been getting worse since the pandemic. And I have talked about this before on the podcast, but my malpractice insurance just sent me a case in which a therapist was successfully sued for operating as a coach. I've also seen some alarming things with religion-oriented therapists as of late, like with the Ruby Franke case, Jody Hildebrandt, if you've been following that. She was a licensed counselor in Utah, advertised herself as an LDS or Mormon therapist, and had been operating with a lot of high renown for decades. And according to the reporting and the allegations this past year, she has been one of the most harmful therapists that's ever lived on this planet, honestly. I'm not exaggerating. There's strong evidence that she has been harming and torturing children for decades, and probably harming a lot of different people. Her family members have been trying to get the Utah authorities to do something for years because, according to them, Jody Hildebrandt has been influencing parents to harm their children. She advertises herself as a parenting helper, therapist, coach sort of person. And she is a licensed therapist, and she also claims to be a life coach. So anyway, her family members have been trying to get the Utah authorities to do something about this for years, but nothing happened until a child escaped her compound earlier this year, 2023. And the child escaped and told the neighbor, it was like, oh my God, help me, told the neighbor that he was being tortured for days. And like I said, Jody Hildebrandt was a life coach. Now, I want to be clear that coaches are not inherently unethical, and therapists who are also life coaches are not inherently violating an ethical code or a law. So I want to be clear that coaches can be helpful. In fact, for many years, I worked alongside a life coach here in Seattle that had a lot of positive reviews. And this coach would actually refer a lot of his clients to me. He would refer clients to me who he detected as suffering from either a clinical issue or a significant marital problem. He would ethically determine that some of his clients needed someone in my field, not in the coaching field, and he would refer his clients to me, and then his clients would come to me. I would hear about the way that he operated through these clients, and everything seemed on the up and up. So you can have life coaches or coaches that know what they're doing, that operate quote-unquote ethically, or at least operate in a way that us therapists would not criticize. So there are those people that do that. But there are many others, many others that do not operate in what we as a field in psychology and psychotherapy, and also the public at large, would not characterize as operating within ethical or moral bounds, which I'll get into in this episode. Part of the problem with even discussing this topic of life coaching is that life coaching or coaching can mean anything from one or two sessions of career advice that last 15 minutes each, two 15-minute discussions of just what should I do with my next career, or should I take this job, or how do I get a promotion? It could be something as simple as that. Or life coaching can refer to 10, 20 years of coaching about dozens of issues, including marital conflict, social anxiety, existential dread, someone needing religious guidance, someone suffering from a lack of motivation, i.e. depression or grief, this sort of thing. It could refer to that, right? Life coaching can refer to 10 sessions about how to start a business. It can refer to 5 sessions about how to flirt. It could refer to a year of sessions about how to be a good parent, how to help your neurodivergent kid in school and at home. Life coaching can refer to long-term coaching that mainly involves just venting about one's life, and that very much could look like therapy. Or a life coach might help someone to find themselves, whatever that means, and so on. So, when we refer to life coaching, everyone has a different idea of what it is. and apparently is a lot of different things, which I think is part of the problem. Because if life coaching was just about career advice, or it was just about how to clean your house, or it was just about how to socialize at work a little better, or how to dress, or how to decorate your home, then yeah, those are not clinical topics, right? But so often, life coaching absolutely gets into what everyone would consider to be a clinical topic: depression. Now, the coach might not call it depression. They might not even know what depression is because they might not have any education or training in that area. They might not even, quote unquote, believe in depression. So they might be talking to someone. They might have a client who suffers from what would likely be evaluated as suffering from a mood disorder, but the coach either doesn't know or is choosing to ignore that so that the coach can retain a client and earn money. So, there's just a lot of issues there. The other issue is that for many coaches, again, since they don't necessarily have training, they might not even know how to detect depression to begin with. Even if they knew of depression or believed, quote unquote, in depression, they might have no idea how to evaluate it. Because of course, why would a because coaches are lay people in psychology. I think that's important to emphasize. Now, again, I want to return that to say that there are many coaches that are absolutely aware of that. There are professional organizations that are trying to develop an ethical standard to follow, but there's no mandate for a life coach to follow these ethical standards. They're just internet websites and organizations that provide trainings that have no authority over life coaches. Whereas for me, as a licensed marriage and family therapist and someone that is trained as a psychologist, for me, I have the ethical codes of the AAMFT ethical codes. I also have the codes of the American Psychological Association that I am expected to hold myself to. And I have a ton of training in it, and I have a ton of supervision that I have attended, just hundreds of hours of supervision alone. I mean, forget about all the hours in school because I have basically 2 masters and a doctorate. It's a shit ton of class time. And in addition to that, all the supervision that I've been through, just hundreds of hours of me talking with supervisors so that they can teach me and guide me and mentor me. So it's a lot of training, right? Well, life coaches might not have any of that. In fact, typically I would say they don't. Now, I suspect, and I've said this many times before, that in the future that coaching will be a regulated profession, that you will either be certified or licensed by the government in the United States, in your state, to provide coaching. And so when that happens, there will be standards of training and ethical codes and continuing education, and there will be a license. And when licensed coaches violate those ethics or those laws, then their license can be stripped or sanctioned in some way, in the same way that for us mental health clinicians, that is true as well. The same with medical professionals. But when that happens, in all likelihood, there will be another name that will be developed, because there's always going to be a group of people that will want to practice outside of licensure. Because once you have all those requirements of training and ethics, that will probably just get more robust as time moves on, because that's been the case for all the other professions. Like with marriage and family therapy, for example, the requirements of training and ethical codes were minimal 30 years ago as opposed to today, because things just get more intense and there's more expectations, there's more case law to alert us to things that need to be discussed. And so with coaches, it will probably be that way, but that will just leave a whole group of people that don't want to be trained. They don't want to bother with that. They don't want to be held to that standard for whatever reason. They don't want to be limited in terms of their behavior, because once the coaching profession is established, there will be very firm boundaries regarding what a coach can and cannot do. So there will always be a group of people, I imagine, that will not want that restriction. So there'll be another name. Like maybe coaching will become a profession, but life coaches will remain not a profession, you know what I mean? Or guiders, mentors or something. There'll be some other name that will be developed, and I'm all for the free market to some extent, of course, as long as there's adequate protections for the public and the consumer. And I think it's totally fine that they're like right now, I think it's absolutely true. I don't want to make coaches illegal, but I think that there needs to be a lot of education to the public as to what coaches and therapists are and what the differences are. And I think that this is becoming a problem because a lot of therapists are also becoming coaches and muddying the waters. And I think this is resulting in a lot of misinformation to the public about what therapy is and what coaching is, which I'll get into. Now, another caveat is that in some forms of therapy, they will refer them to themselves as coaches as opposed to therapist or counselor, like with Bowenian therapy. If you've heard my deep dive on Murray Bowen, he and colleagues would train their therapists to refer to themselves as coaches, but that's very different, and this was 40, 50 years ago. So they weren't saying to change your profession from therapist or counselor to coach. They were just saying, refer to yourself as coach because it demotes you on the power scale, because you don't want to create a dynamic with the client where you're the expert and the client is the person who doesn't have power or knowledge. And also it, I think, was an effort to help the clients back then to understand that the therapists weren't there to diagnose and to fix certain problems. The therapist was there to help the client to become differentiated, to coach the client to become differentiated. Anyway, you can listen to my deep dive on that. But that isn't to say that these professionals considered themselves to be outside of their ethical codes or outside their profession. They just use a different word. So I just want to throw that in there. Okay, so let's take a break. And when we get back, I'm going to go into the case that my malpractice insurance sent me regarding a counselor who was successfully sued because of this issue of the therapist also being a coach. All right, let's take a break. All right, so this is the case write-up that my malpractice insurance sent me. So the case involves a counselor, a licensed professional counselor, who has been a licensed professional counselor for 20 years. So the counselor who was sued has a lot of experience, 20 years. They're not directly out of grad school. The counselor is male, and he practices somewhere in the United States. He's in private practice. He was in private practice. And he specialized in treating clients who suffered from substance use disorders. But I'm guessing in all likelihood he treated all sorts of clients, but I don't know that. But he claimed and advertised himself to specialize in working with substance use disorders. He also offered life coaching services to some of his clients. The case write-up was clear in stating that he has no formal training as a life coach, and he is not certified by any sort of entity or any sort of professional organization of coaches. Now, he doesn't need training in coaching to claim and to be a life coach and to provide life coaching because there is no guideline, there's no regulation around that. But the write-up said, by the way, he also didn't have any training, which might have helped, but who knows? It's unclear. So getting into the treatment, he began treating a client who was male in his mid-20s, so a young man. He was homeless and he was also unemployed. And he had a criminal history and he also had a history of substance use. The client was referred to the counselor by the court. The counselor assessed the client with generalized anxiety, substance-induced depression, and antisocial personality disorder, and the counselor proceeded to provide psychotherapy or talk therapy to the client. They didn't go into detail as to what the counselor was doing. And the counselor also provided life coaching. So both therapy and life coaching, and the clinician, the counselor, was clear about that. Okay, so let's take a little bit of a sidebar here and talk about the problems with coaching and also the problems with therapists providing coaching. Again, I want to provide a caveat that many coaches are very ethical and are providing a wonderful service to many, I've heard from many people along those lines, clients of my own who have been to coaches and benefited greatly. And there are many therapists that are also life coaches who use this form of service and this dual provision of service in a completely ethical, above board way. And they are also very helpful people. Okay. Having said that, I want to comment on why a therapist would even be a life coach to begin with, because it's, to me, a little bit of a strange decision. But I'll also say as a caveat that there are situations in which that would be good. Like, I know someone who is a therapist, and she's very good as a therapist. She works with couples and individuals, and she provides coaching for people regarding dating and flirting. She's very good at helping people, teaching people how to meet someone, how to flirt, how to date effectively, and has helped many people along those lines. So the therapy profession and job that she does is, standard therapy with all the sort of things that you would expect. But she also advertises herself as someone that can help someone to date well. Well, it's not traditionally a clinical problem. Now, I will say as a therapist, I have helped people with flirting and dating. It's not a common topic, but you practice long enough with the sort of clients I work with, and I have helped clients with that. And during those conversations, I didn't say, by the way, I'm not providing therapy right now. I'm providing a coaching service. No, it's all therapy. That wasn't the reason why they came to me. It was just among them. You work with clients for years and years. There's going to be a lot of things that come up. And I felt that, at least with that topic, that I know enough, both personally and clinically, to help people with it. Anyway, whereas like if a client were to ask me about like how to buy a car or how to do their taxes or how to renovate their kitchen, I wouldn't, provide that sort of coaching or that sort of help. You know what I mean? I'm saying that I would only help a client with something that I had reason to believe that I knew what I was talking about enough to help them and not harm them. Anyway, so with this therapist that I know, she does both of those things, and they're very separate. She works also with these coaching clients around how to meet someone and how to flirt well and how to dress, how to smile, how to make conversation. And there's nothing clinical. So if the client were to bring up something clinical, then this therapist that is also a coach that I know, she would, stop the coaching session and say, I need to refer you to a therapist. In fact, she wouldn't even necessarily work with that client in her practice because she would worry about the dual roles. So she would refer that student in her flirting class to another therapist while retaining that student as a student, right? So, keeping those boundaries very, very firm. So again, there are people that can do this, but I have seen so many other cases, which I want to get into. There's a lot of people, and increasingly so over the past, like I said, 15 years, but more so in the last 5 years. I really didn't hear very many, particularly in my circle, I didn't hear a lot of therapists talking about being coaches because there's enough to do within the profession of counseling and therapy that why do you need to become a coach? So increasingly, more recently, I start hearing, even in the circle that I'm in, people starting to say like, well, I think I'm going to start a coaching side business because of X, Y, and Z. So let me talk about X, Y. Why would someone do this? Well, one of the things that they will say, and I see this online as well, is that they will say, well, coaching is action-oriented. It's goal-oriented. Coaching is for people that want to take action, whereas therapy addresses mental health. Okay, so what do they mean when they're saying this? Well, I think what they're trying to say, which I don't agree with, by the way, is that therapists don't help someone with discrete short-term goals. Like, I want to, get a better job, or I want to clean my house, or I want to quit smoking next week, something like that. And the idea is that therapy is about like trauma and talking about your feelings and about providing evidence-based treatments. And, none of that is involved with trying to find a job, that sort of thing. But there's actually a lot of training and a lot of precedent in our field for decades around career counseling. I mean, it's a whole wing of the counseling profession. And there are, there's research and measurements, assessment measurements to determine aptitude and preference of the client. And there's whole protocols of how to help. So therapy can be very action-oriented. I had a client once that came to me for quitting smoking. That's all he came to me for. And since I know enough about addiction and treatment and recovery and smoking in particular, because I used to have a problem with it myself for many years and successfully kicked the habit, which was not easy. Perhaps the hardest thing I've ever done, and learned a lot through that several-year process of failing until I succeeded. 23 years ago? 23 and a half years ago. I still have dreams that I'm smoking. It's weird. I have in a dream, I'll just be like casually smoking a cigarette. And then all of a sudden I go, oh shit, I'm smoking. I shouldn't be smoking. And then I remember all these other times that I've relapsed, but I'm remembering other dreams. It's the weirdest thing. In my dream, I'm always convinced that I've been relapsing off and on for the past 23 years, but I'm literally remembering other dreams in which I relapsed and realized I was relapsing. And it's such a relief that when I wake up, I'm just like, oh my God, not only did I not relapse in that moment, but I haven't been smoking for 23 years at all, not even slightly, And so anyway, those are weird dreams. And another kind of weird part of the dream is it feels bad. It feels really bad. It's not like, yee, I got to smoke. I just feel so demoralized because it was very demoralizing when I would relapse back in the day. It took me about 3 years to quit. But so anyway, a client would come to me just for that, and I provided therapy for that. And I think the session count was 3 to 5. It was very short. And I don't know if he sustained his abstinence, but he did achieve abstinence, and I did provide a lot of education and other kinds of tips about that. So that's extremely action-oriented. It's also fucking therapy and considered mental health. I mean, it's a diagnosis in the DSM about a use disorder, and there's a whole protocol about how to do that. Now, I'm not saying every therapist has the competence to provide that kind of treatment, but it's certainly under the umbrella of that. It's under another umbrella of substance abuse treatment, right? There's a certification. Is there a licensure for that in Washington State? Anyway, there's a process of becoming a legit government, identified individual in substance abuse treatment. So it's also for those folks. Anyway, so also there are many forms of therapy, theoretical orientations, that are absolutely action-oriented. So this idea that coaching is action-oriented and therapy is not is false, because there are forms of therapy we literally have a whole wing of therapy called brief therapies. There's a set of theories and modalities that are under this umbrella called brief therapy. In fact, whenever I will state the theories that I hold to as a therapist, I will rattle off the umbrellas, the larger categories of theories, because I'm such a theory nerd and have been for so long that I know in session I am calling upon all of these umbrellas and specific theories underneath each umbrella. Sometimes they call people like me eclectic. It's more fashionable today to call ourselves integrated, but whatever word you put to it, I fall within the camp like John Norcross and other folks, other psychologists and researchers that will find, according to research, that it's best if us therapists actually have a wide range of theories that we are competent and knowledgeable in, because then we can tailor the treatment to the client and the situation rather than the other way around. And so, just to rattle off those, it's been a while since I've done this, so let's see if I can do it. So there's the whole psychodynamic umbrella. Attachment theory could be argued that it's underneath the dynamic umbrella, but I would say it's in its own separate. So all of attachment theory and all the research and the types of therapy like EFT and other kinds of things that use attachment theory. Then we have systems theories, family systems theories, and just general system theory. I also use feminist and cultural awareness as maybe a term that I would, context awareness, power and privilege, and socialization and bias and prejudice and cultural harm, gender harm. So that's another umbrella. Another umbrella is brief therapy, such as solution focus and narrative and Milton Erickson and solution-oriented. And you could argue CBT is kind of another umbrella is cognitive therapy. I don't say CBT is in the same because it's really two different whole wings of therapy, of cognitive theory and therapy. And then you have behavioral theory and therapy. There's also, what am I leaving out? There's also neurological ideas. There's not really a neurological theory, but there's a lot of brain science and neurology and biology, physiology. Of course, medications are in this, but also you could argue that like sleep and other kinds of knowledge about the brain, executive function, that kind of thing, amygdala, that's another umbrella that, of course, I adhere to because why would you not? Humanistic therapy, I use, there's a lot of schools underneath the umbrella of humanistic therapy, positive regard, empathy, self-disclosure, authenticity, being real with your clients, helping clients to be real with themselves, helping clients with their emotions, expressive therapies, experiential therapy, it's a wide thing. So anyway, brief therapy is a whole field, and it's argued that you could argue that within brief therapies, they are very action-oriented, like solution focus, like motivational interviewing, like cognitive therapy, like behavioral therapy, like REBT, rational emotive behavioral therapy. You could argue ACT is under this category. I'm not sure everyone would agree with that. And also humanistic therapies can be this way as well. There's many accounts of some of the main figures within humanistic therapy that will give cases in which they treated a client for 5 minutes and helped them, So those can be very action-oriented. If I just think off the top of my head, the sort of action-oriented goals that I've helped clients with, or at least attempted to help, like quitting smoking, quitting any substance, helping them just with their sleep, just help them get better sleep at night, and evaluating that whole sleep system, right? Biological, their environment, sleep hygiene, of course, their cognitive reality, what do they think about when they're trying to fall asleep, the worries, because a lot of people will have trouble falling asleep because they're worried about not being able to fall asleep, or they're worried about something the next day, or they don't know how to control their thoughts. So their mind is racing when their head hits the pillow. There's just a lot of different things that therapists can and do help clients with regarding sleep. And that's a very action-oriented thing, right? Now, could a coach help someone with sleep? Yeah, as long as it didn't get into clinical areas like depression or medications or other kinds of things. Cognitive notions are not necessarily a clinical idea, right? If you had a friend that said, hey, it helped when I do this at night, and maybe that'll help you. Your friend isn't providing a clinical service in that moment. So, but again, a lot of the literature trying to sell coaching to the masses and also trying to get therapists to become coaches, and the justifications a lot of therapists will say, I'm a coach, is they will say, I want to also provide this other service that is action-oriented. And it's like, no, therapy can be very action-oriented. Now, like I said earlier, there are many things within the action-oriented camp that therapists would not provide, services that therapists would not provide, like how to get organized in your house. Well, but even that, I've helped clients with organization. I don't go to their house. Well, I have done that. So when I did in-person or in-home therapy for about 10, 15 years, the first 10, 15 years of my career, I did that. And, occasionally clients, families, like a common scenario would be I would have a 15-year-old kid with ADHD who was having a hard time with their ADHD and was having a hard time with organization. And I would be in the home, and I would be contracted by the government to go into the house. And there's usually some bigger problem, like the kid ran away or got in a fight at school or something. And at some point, I'm treating the family, and I would say, okay, well, here are the options. Let's look at an assessment. Let's look at medication. Let's also look at specific therapies or techniques to help someone with ADHD. And one of the things that you can do is you can help the person with ADHD have a system that works within their ADHD and accounts for it. Like, for a kid that doesn't have ADHD, you don't have to remind them to turn in their homework when they get to school, because the way that their brain works, more often than not, their working memory and their executive function, their neuronal reality is such that they will just naturally remember. It will just occur to them, oh, I better turn in my homework. You don't have to remind them. Not necessarily, but they're much more likely. Whereas someone with ADHD, it'll be very difficult for them to remember that, because their brain is different and their working memory is not as good. It works to some extent, but it doesn't work as well or in the same way. And so when they get to school, they don't have that kind of this category of working memory. And there's all this science and theory and language around this, and I'm using my own just for the sake of brevity. But this type of working memory is kind of weird. Like if you don't have ADHD and you wake up in the morning, like my wife is kind of like this. She doesn't really have a system of reminding herself to do things. She doesn't really have a calendar. And my mind is always just blown away because for me, I have everything in my calendar. I mean, down to and I think I developed this because as a therapist, when you have 30, 40 appointments a week, including clients and supervision and other kinds of appointments, there's no way that you're going to just remember that, right? You have to have this very clear list. And I became very oriented from the time I was in my mid-20s till today to my calendar, where I just compulsively and reflexively look to my calendar throughout the day, because I just never know what I'm doing, even today. And so my wife is like this, where she wakes up in the morning and she's very responsible. Like, she is the opposite of flake. I can't imagine anyone having ever described her as being a flake or irresponsible or late. We're perfect for each other because we're both extreme on-time people, pathologically on-time people. And so even though she doesn't really have a system, she still remembers. It'll just occur to her, oh, today's Wednesday. This is the day of my dentist appointment. It's at 2:00 or something like that. I mean, that's a little extreme because she probably writes that down, but even so, you know what I mean? Whereas people with ADHD, they're not. So my point is that I'd be working with a 15-year-old about how to account for the fact that they, in all likelihood, have a deficit in that and will never just develop it out of thin air. They have to have workarounds. They have to have a system. And so I would go through physically with them. Let's look at what your bag looks like, your backpack that you bring to school. Where do you put your homework? Where is your homework now? What sort of reminders can you put to yourself to have a routine? Because the more routine it is, the more likely you're to remember it, right? So if they have a routine where every single time they enter a classroom, they just have to remember one thing, which is to open up their bag, pull out their calendar, and look at their calendar. And on that calendar, it'll tell them, turn in your homework. And they might have even written that themselves the previous night after they did their homework. They wrote down in their calendar, turn in your homework. And so when they enter class, they open it up and oh yeah, that's right. They wouldn't necessarily remember that. So it reminds them. So anyway, that's very action oriented is my point. So hope you get my point. I'm rambling again, but so that distinction is a little funny. Now, as I gave that example earlier, where my friend and colleague, she provides regular therapy and life coaching for flirting and how to meet someone. That's a class format with 1 to 10 students at a time. It's a set number of classes, like 5 to 10 classes, and it's a particular kind of vibe, right? When she's in that vibe, she's not the same as when she's a therapist. She's like, "Hello, everyone. Let's talk about this." And clients aren't encouraged to go into their traumas or anything like that. If they bring up a trauma, she would have ground rules about that sort of thing, and or pull them aside and say, "Hey, I'm going to recommend that you talk to a colleague of mine." So that is very action-oriented and can work in that way. But like I said, there's a lot of action-oriented things in therapy that would also, anyway, okay. So that's one reason why therapists will say, "I'm going to become a coach as well," is because they're trying to say, "I want to be action-oriented," which is weird to me because unless it's very specific, like a class on how to help people flirt, there's no reason to do that. Because, what a lot of therapists are doing is they're just taking clients in the exact same way with the exact same issues, like marital conflict or trauma symptoms. They wouldn't be identified as such, but, like just a lot of distress. Someone has a lot of distress about their life. They don't really know why, but they just know that their life isn't going well. And these therapists will take on these individuals in their life coaching wing of their job. And it's not discrete, right? It's not like how to flirt. It's like general problems that probably are clinical. Anyway, so another reason why a lot of therapists will say, "This is why I'm becoming a coach," is what they will say is because of marketing. They will say that, "Well, I want to appeal to people that have stigma about therapy," because a lot of people have a stigma about going to see a therapist. And so I want to help those people. And what I'm going to do is I'm going to call myself a coach. And I've had a lot of clients come to me saying that they would never see a therapist, but they absolutely don't mind seeing a coach. Well, unless it's a legit coaching practice that is highly limited in terms of its scope, in terms of what sort of things you're doing, you're just providing therapy to people and calling it coaching, right? Another problem with this is that, well, yeah, stigma is a problem, and helping people to get to therapy is something we need to be doing. But we shouldn't destroy our profession or our practice to accommodate the stigma. We should try to reduce the stigma, right? So that people go to therapy when they need to, right? Or at least when they suspect they need therapy, they get assessed by someone. So that justification doesn't make sense to me. Another justification that I'm hearing more recently is that people will say, "Well, I wasn't making enough money as a therapist. I couldn't pay my bills. I couldn't pay my student loans. But as a coach, I can actually pay my bills." Okay, so that can be a legitimate reason that could result in a legitimate dual practice of being a counselor and a coach. Having said that, what I hear from people is that they're not very thoughtful. Like with my colleague, I don't know, I doubt this was her motivation, but it could have been, but I doubt it was, that she's like, "I'm not making enough money in my regular clinical practice. I am really good at teaching classes about flirting and how to meet people. And if I appeal to a certain richer or wealthier audience and I package my marketing well enough, I might be able to charge a lot, especially if there's a lot of students. Say, if every student paid $50 an hour and I have 5 students or 10 students, that's $500 an hour. And I don't have the paperwork or the clinical responsibility. I could just teach that class. So can that be a legitimate reason? Say, I'm not making enough money in my practice. I need to do this other thing. And I can sort of use bits and pieces of my clinical expertise in my coaching practice while not actually providing a clinical service and being very clear about that. Yeah, you could do that. But what I hear from a lot of people, anecdotally, is, I guess it would have to be anecdotally if I'm hearing from people, is that they're just accepting clients as coaching clients And because coaching can be a variety of different formats, like it's not uncommon for coaching sessions to be shorter than an hour. So you can have a coaching session that's like 15 minutes, right? And if you provide a very sought after service, then you could charge $100 for that 15 minutes. And if you have 4 people in that hour, then you have $400 an hour, which is, typically a lot higher than the, price or the fee that therapists will offer. Typical, I think, average American fee would be, I don't know, I'm just going to take a guess, let's say 100 to 150, 170, I don't know, somewhere in that zone. And so, they're making more money. Now, if it's a legit, actual coaching practice and the therapist has a lot of boundaries around this whole thing, then that can be a way to do it. But that's not what I'm hearing. What I'm hearing is therapists that are marketing themselves as coaches, appealing to people who might have stigma about going to therapy, packaging it in this sort of executive marketing language, providing at times an absolute clinical service, and advertising themselves as a therapist who's also a coach. In fact, a lot of the recommendations around this dual profession or this dual career for some therapists is that if you are ever talking to someone about your coaching practice, you do not mention that you're a therapist. You don't mention that you have qualifications as a therapist. You don't mention that you have a master's degree in counseling. You just talk about your coaching credential and your coaching experience and what coaching can do. Because even if coaches did say, therapist coaches, even if they did say to a client, hey, I also have a therapy practice, even if they did say that to their coaching clients, it's possible that the client would confuse that and would use coaching for clinical, you could absolutely see that. And I wouldn't fault the consumer for that, right? The client comes in and, initially talking about coaching concerns. And then at some point it's like, oh, wow, yeah, well, I guess I have to kind of talk about my mom and the way she treated me. And the client is like, well, you're a therapist, so you can help me with that. I mean, people do that to me in my personal life. I'll have people in my personal life that will say like, well, you're a therapist, so, you can help me with this, or you're a therapist, you can react to this differently, even though I'm not paying you. And, and I would say, no, I'm not your therapist. I am a therapist, but I'm not your therapist. I'm just a regular human. It does, I can help people, but it doesn't mean necessarily. Anyway, point is that some people will say, well, I needed to start a coaching practice because I wasn't making enough money as a therapist. Okay, so let's look at that. One, what that tells me is that the person is early career, which is another thing that I've seen anecdotally, is that early career therapists will want to, they have a vision as to how much money they're going to make. And early career as a therapist, often it takes a while to get to that place. It did for me. I was earning $13 an hour, which I think is about $26 in today's dollars, something like that. And it was hard. I was earning $2,000 gross income, or after taxes, something like that. Yeah, probably after taxes, $2,000 a month. And due to my student loans and credit cards, I had interest of $1,100 a month. So I really only was making $900 a month to pay for a very cheap apartment and a very shitty car with 300,000 miles on it. All my clothes were from secondhand stores, and I didn't have cable TV. I mean, I barely had a TV. My TV was like this really crappy 13-inch piece of crap. Anyway, so yeah, it sucks in the beginning. And let's talk about that, and let's change that, or let's work on that. And may I help you with building your career and earning money so you can pay your bills. But that isn't, in my view, a justification to say I'm going to throw out my ethical codes and my training and become a coach and treat clients very similarly and advertise myself very similarly because I want to make more money. I just don't understand that. Plus, this is what I'll hear. They'll say, being a therapist doesn't pay enough, full stop. And I think, well, maybe where you're at in your career, or maybe your community is another thing. Maybe in your town, the expectation about fee is lower, or there's not enough clients to go around or something. And yeah, I get that, but that's not a reason to break from your profession. That's motivation, or that would be a prompt. If someone came to me and said, I'm in a small town and I just graduated and I'm trying to build a private practice and it's been a few years and I've worked really hard and I've marketed myself well and I have a mentor, and yet I'm still not able to pay my bills because I only have like 5 clients. Then I would say, well, I wouldn't say start a coaching practice. I would say, well, maybe you should look at other communities that are nearby. Now, in today's world, post-pandemic, most therapists are online these days, as far as I can tell. So that wouldn't be a problem, but I hope you get my point. Because according to statistics, therapists make a fair salary. And that's including therapists that work for agencies, which typically does not pay that much. Again, anecdotally, and in Seattle, the cost of living is very high compared to other cities in the United States and the world. So just take that in consideration. But, anecdotally, I would say that after a few years, and I trained and mentored hundreds of therapists post-grad because they would, hire me as their supervisor post-grad. And I would say anecdotally that in today's dollars, and I know recent grads that are in this situation, after a few years, they're earning at least $150,000 a year, if not $200,000 a year. Maybe $100,000 if things. Because the other thing is marketing. What I've learned about the difference between a therapist that makes a lot of money and a therapist that doesn't, a therapist that has a lot of clients versus a therapist that doesn't, has little to do with their ability. I mean, it has something to do with their ability as a therapist, but I would say 90% of it has to do with how good they are at marketing. And you don't even have to be very good at marketing. You just have to be motivated. You just have to put in the effort. It's not even that hard. There are little things like just being a part of certain Facebook groups where frequently there are people saying, I'm looking for a therapist for this. There are therapist Facebook groups where other therapists will be looking for a referral. And if you stay on top of that and respond quickly and have a good elevator speech, even mildly good, then in my experience, that's one of a few factors that can result in making the difference between a early career private practice therapist that makes $200,000 versus someone that makes less than $40,000 a year. And I've seen that. I've been ground level, because I would work with these folks for an hour every week. And, for the folks that were not earning very much money and didn't have a lot of clients, a lot of our discussions were around marketing. I mean, because, I had a supervisee once that had basically 1 or 2 clients in the span of like 3 years. So you run out of stuff to talk about because in supervision, you're supposed to, mainly you're talking about clients. Well, there's not a lot to talk about if the therapist only has a couple clients in the span of a few years. And so we spent a lot of time talking about marketing, and I, figured out a lot through supervisees like this that there's just some people that put in the effort and some people who don't. And it's kind of weird, and I don't really understand that difference. There's a little bit of savviness involved, but the things that anyway. So to make more money, to me, is not a viable reason to become a coach if you're a therapist, unless you have a particular topic like flirting and how to meet people, how to date, or some other narrow thing that you're really more interested in teaching to people rather than providing a clinical service. You know what I mean? Maybe that's one way to look at coaching, is that, I don't know if this holds water, but if the concern for the coachee could be considered something that you could take a class about, then it's a legit coaching focus. You can have a class on how to flirt. You can have a class on how to organize your bedroom. You can have a class on how to best plan your career. you can't have a class on how to recover from trauma. You can't have a class. I mean, you can't. There's no, I mean, you could have a class, I suppose, but it wouldn't work, because it has to be tailored. There's so many clinical issues that have to be closely monitored by an expert, not just a therapist, but an expert in trauma. Can you teach people how to not have marital conflict? I would say no. You could have a class that could maybe help, but it's so nuanced, and especially clients with personality disorders, when they take a class, they're going to misinterpret the information. Like if you talk to, and I would see this happen, and this happens a lot like with TikTok, like because people turn to TikTok as an educational tool, which is fucking ridiculous. I mean, there are some good, educators and clinicians on TikTok, but they get buried underneath all the bullshit because of the algorithm. So, I would have clients that would come to me, couples that would have taken a class, and say the husband has, let's just go with borderline personality disorder again, and he would have learned a good tip, like when you are upset, it's good to talk about your feelings like I statements instead of being accusatory. Well, this fictional client will come to me and say, yeah, I totally do that all the time. I say, I feel like you don't care about my feelings. And I feel like you are a distant, withholding jerk face. Okay. So that's not a true application of what they are being taught, but that's not a mystery to us clinicians, because people have traumas and schemas and, emotional issues and histories and resentments. And so those things are not accounted for when you're just taking a class or watching a TikTok video. Anyway, but, I don't know if that holds water in terms of, like, you could take a class on meditation, you could take a class on mindfulness, and coaches can help someone with mindfulness and with meditation. That to me makes sense. Okay. Another reason why I will hear therapists who want to become coaches also is they will say that, hey, you can practice across state lines. So if you don't know, therapists in the United States are only licensed in the state that they're licensed in. Now, a therapist can hold a license in multiple states. I have friends and colleagues that do that. They have a house in California and a condo in Seattle, and they travel between both places, and they have a license in both states, and they can provide therapy to people in both states. But that's not the typical situation. And even if you did have 2 state licenses, that excludes the other 48. So now I get this problem, and it upsets me and bothers me. I know that there's at least a little bit of a movement to try to federalize the laws and the licensure, because if we had a federal law, or at least a law that said, look, if you're licensed in one, it's sort of like with a driver's license. It's the same actual thing. When I cross state lines and I drive into Oregon or Idaho, I don't need to get another driver's license, because they have passed laws that say, I don't know the exact laws, but it must be along these lines, that says, look, if someone, if a state licenses someone to drive, then by law, they are now licensed to drive in all of the states. Well, you could have that for therapists, but for whatever reason, that doesn't happen, but it could happen. And if we put our minds to it, it's a no-brainer, because especially with online therapy, what's the difference these days? Point is that this is in the same category of a therapist saying, I'm not making enough money, and so I'm going to become a coach. This is underneath that umbrella, I guess they're saying. I'm not making enough money, so I need to get clients from outside of my licensing area. And so in order to do that, I'll just be a coach. Again, if it's a legit coaching practice that is very limited to a set of coaching specific topics, then okay. But I see a lot of people that will, like a common scenario that I'll hear is there'll be a therapist that will provide coaching, and they get a coaching client. I don't even want to call them clients, coaching consumer, a coachee from another state. And they start out with a limited goal. Like, I want to, I guess this is pick career, even though that's not typical, but I want to work on my career. Okay. So the client and coach talk about career for a couple sessions, but very quickly the client starts talking about their husband and how their marriage is falling apart and how their parents treated them badly and how they have some odd thoughts sometimes and they are worried greatly and how their sleep isn't going well and they're on antidepressants, but they don't know if it's helping. And, typical kinds of clinical assessment and exploration and things that are talked about in therapy. And what the coach will do is justify to themselves and say, well, I'm not saying the word depression and I'm not saying the word, OCD or something. I'm just listening. So the coach proceeds to listen, and the client absolutely knows that the coach is also a therapist and wants to blur that boundary, which is fine because as a consumer, they can want whatever they want, and what do they know? And so the client starts to vent and look forward to sessions so that the client can complain about her husband and the which I'm not denigrating. Complaining about one's spouse is one of the foundations of therapy. Not that as a therapist, I or other therapists are supposed to play into that and say, yeah, your spouse is such a jerk face. But it can be a pretty robust or rich, fertile ground upon which therapy can take place in a variety of different helpful ways. But anyway, so the therapist / coach starts to listen. The client starts to cry. The therapist is, using reflective listening, which is a therapy technique, right? Not always, of course. Lay people can use reflective listening techniques. There's a lot of empathy, and the therapist starts saying little things like, well, it sounds like there's some issue with some projective identification, and it kind of works as this, or, wow, it sounds like there's some anxiety going on there. There's like some mild therapy talk, but the therapist continues to justify to themselves, look, I'm not providing therapy because I haven't provided an assessment and I'm not doing my normal DBT or my EMDR or whatever. And so therefore, this is coaching, it's not therapy. And maybe it is coaching and not therapy, but it doesn't look like that to me. It very much, if I saw these sessions, it would say, oh, obviously this is a therapy session. I'm not hearing like overt language, but rarely do therapists use overt therapy language with their clients because it'd be weird. It's jargon and terms, and clients don't know what you're talking about. So anyway, another reason why therapists will say that they're becoming a coach is because they want to skirt ethical and legal responsibilities. Now, you're not going to hear this in public, but I will hear people say stuff like this. They will say stuff like, well, like I want to treat someone outside of my jurisdiction, or I want to be able to do this avant-garde type of therapy that is a little questionable, a certain touch-based, body-based therapy, and I don't want to have to answer to the ethical codes or to the authorities because I know that this therapy works, blah, blah, blah. And along those lines, there are ways like with touch and somatic therapy. Yeah, it is a bit risky, but there's a whole field of that within our profession. There's a lot of research. There are ethical codes that are provided by organizations that use somatic and touch therapy. There's a whole protocol about what you do with informed consent and with consent each time with clients. You can, as a therapist, do some pretty wacky shit in therapy and do it ethically and responsibly, minimizing risk to clients. So this idea that one would need to skirt the ethical requirements or responsibilities is problematic in a dozen different ways. Also, I will hear therapists say stuff like, well, I just hate the paperwork. And if I were a coach, I wouldn't need to have any paperwork. I'll hear stuff like that. Or I'll hear someone say something like, I want to be able to provide a service to people that I work with. Because, people I work with, they often will ask me for help. And ethically, it would be considered a multiple relationship, a dual relationship, probably a problematic relationship if I was to provide a service to my coworkers that I work with every day, 40 hours a week. So I'm going to have this coaching side gig and make all this money and provide that service. Again, pretty problematic. And there's a whole lot of things that I've heard in this. Or another thing that I heard and saw was someone was a student, and not my student, but a student that I had heard about, who was not licensed yet as a clinician, but she had learned a lot about how to be a helper, how to be a therapist, a clinician, but she wasn't authorized to. I think what happened was, for whatever reason, people were reaching out to her online to get clinical help from her. And at first she would have to say, well, I'm not licensed yet, so you'll have to wait a few years until I am, or I'm an intern or whatever, And, but over time she started thinking, well, there's all these people that want my help, and I could start making money, and I could start paying off my student loans early if I took on these clients, but I'm not authorized to. What's another answer? And then somehow she heard about coaching, and she's like, oh, okay, I'll just be a coach. Anyone could be a life coach. So I'll just tell these people, look, and I'll be very clear to them, this is not therapy, I'm a life coach. Again, if it was legitimate life coaching and was within the limitations of life coaching, then fine. But it didn't sound like that. It sounded like she was providing therapy light, which is not therapy. Therapy light is still therapy, right? This is a problem. And really, all of this points in one direction, which is that there are, I don't know the percentage, maybe there's some research on this. I couldn't find any, but I don't always find all the different studies. But I wouldn't be surprised if there was a really robust, well-funded study that had a really good method of gathering information that looked into the question as to what percentage of coaches are providing a therapeutic, what would be considered a clinical service to their clients. I would suspect that we would be looking at 80% of coaches or higher. I don't know. That's just anecdotal. Again, that's just me making shit up. It could be less than 1%. It could be 99+%. I just don't know. But given my anecdotal experience, given what I've heard from the public, I think that there's a lot of life coaches that are absolutely especially when you think about having 20 to 30 clients in a week or more, right? Because if you're doing 15-minute sessions, you might have like 50 clients in a week. What's the chance that they're not stepping out of the boundary with none of their clients? Now, some life coaches, I'm sure, are doing that, but I know that many are not. And that they are dipping into clinical work, sometimes fully into clinical work, just full on discussing ADHD and medication and depression and trauma. There's many accounts of that. And so the profession, so to speak, of life coaching is a problem in general. And if the public knew better, the problem is that even if we did tell everybody in the public, by the way, life coaches have no credentials, no training, and here are things that you go to a life coach for, whereas therapists do have training, and here's all the things that you can go to a therapist for. Even if you told the public that, and they fully comprehended it and understood it, they still wouldn't necessarily know why they, as an individual, want therapy. So many people will come to therapy with a complaint. They'll verbalize a complaint. But then later, therapists, such as myself, will determine that the real problem was something else. Now, I wouldn't just arbitrarily come up with that. It's a collaboration. And so even if we did educate the public about this line between therapy, and maybe it's a Venn diagram of therapy and coaching, there'd be a lot of people that would end up in coaches' offices, but they don't know that they absolutely should be in a therapy office. And unless that coach is highly ethical, because the problem is that the coach would have to give up money by referring the client to a clinician, right? The coach would have to say, oh, this client that is paying me a lot of money, I actually am detecting the possibility of a problem that I cannot treat, both because I'm not competent and I have no education, but two, because it's unethical and harmful to clients. So I need to refer this person to another profession. And I'm going to lose this person as a client. Not always. Of course, you can have coaching and therapy, but a lot of times you would just lose that client, and thus you would lose that income. And it's not just that one session, right? You could be losing years of an income stream. So coaches have an incentive to either sweep their concern for the public under the rug or go into denial of it. Because when you have monetary or beneficial benefits to taking an action, your brain can play tricks on itself, right? You could just end up tricking yourself into believing this isn't a clinical issue. There's no, even though if you really sat down and thought about it, you would know that it is a clinical issue. Anyway. Now, another thing I just want to point out is that in my experience, many of the therapists who also become coaches are not just problematic in their coaching practice, but they're problematic in a variety of ways. Again, I want to emphasize there are many therapists that are also coaches that are completely above board and are doing a wonderful dual service to society. Having said that, in my experience, like if I heard of a therapist who was also a coach, it's a red flag for me. It doesn't necessarily mean there's something nefarious or problematic or unethical going on. Absolutely. I would have no idea. But like if I had a friend that came to me and said, "Oh, I found 3 therapists online and I don't know which one to go to." And I heard, and the only thing that I had to go off of, and the only thing that my friend had to go off of was that 2 of the therapists were just therapists, and the 3rd therapist was also a coach. And I don't have any other information, and there's no way to get any other information. Then I would say, you're better off not taking that risk of the therapist/coach and just stick to the therapists who are just therapists. I know that some of you out there are probably therapists and coaches, and that is a dick move, but I'm just telling you what I would tell a friend, because I've seen so many therapists/coaches that are problematic in a variety of ways. Among the therapists that I know who became coaches, they almost always had a number of other ethical issues, like they're just in it for the money instead of trying to make a world a better place. They have terrible record keeping. Obviously, in their coaching practice, they don't need to have record keeping because there's no regulation around that, so they might not have any record keeping. But even in their therapy practice, they also have terrible record keeping, because that's one of the reasons why they wanted to become an also coach, is because they hate having to follow rules and they hate having to follow regulations and be ethical. So there's that. Also, anecdotally, I would find that therapists/coaches often had a fairly chaotic personal life that affected their practice, like showing up late to their sessions or not even showing up to their sessions. Particularly early career therapists, it's a good idea that when you have a client that is a little confounding, that you do a little homework. You read up on things or you consult. And I would find that these therapists/coaches would not do that. They would just figure they've learned all there is to learn. Now, again, are all therapist coaches like this? Absolutely not. I have colleagues and friends that are doing great work, but it's just a sign of a problem. Now, does that condemn therapists/coaches? No, absolutely not. But I think that I don't know. I'm trying to figure out what the solution is, really, because it's an unregulated profession. Again, it will be regulated at some point in the future. I would predict within 20 years, it'll become maybe even fewer, maybe like within 10 years, it'll become, at least in some states, a regulated profession. And maybe even by the time you're listening to this, maybe it's a rerun in the future or something. It already is. I don't know. But I don't know if that necessarily solves the problem, because, you will have people that will be minimally trained, right? Because the idea would be is that there would be like a training regimen that you would need to demonstrate to the state to be licensed. But obviously that training would be far less than being an actual clinician, because you're just a coach. You don't need 99% of the training that a therapist does. You don't need any training on diagnosis, maybe a little bit just to detect if there is an issue to refer them out. I don't know. But it would be pretty minimal, Plus, like the types of topics that coaches are typically to be seeing, it's not super complicated. at least for the minimal requirement. Anyway, I'm just trying to figure out the solution. And I guess if I had it my way, a lot of things would be different. There would be no stigma about going to therapy. At the very least, that if you're licensed in one state, you're licensed in all states. I would change it so that early career therapists have cheap access to mentorship. I wrote in my supervision book that a big part of my own trajectory and a lot of the people that I've worked with in terms of professional satisfaction and competence and success in one's career has to do with competent mentoring. And I'm not talking about just like someone you talk to once every 6 months. I'm talking about like, really highly attentive mentors. In my life, I had those sorts of people, Paul David being one of them for me, the main one for me in my early career. But also I mentored many, many therapists along those lines where I would, I wasn't just there to talk about their cases. I was there to talk about everything, including their personal life, and as it pertained to them being a therapist and as it pertained to their career, I'd spend a lot of time looking at their marketing. I would learn from other supervisees. I'd look at those supervisees that were very successful, and I would take note of how they marketed their practice, and I would teach it to my other mentees. And I would find that some supervisees, even though I taught them how to market, they still wouldn't do it for some reason. And I would work on the barriers, like what's the barrier that's preventing you from actually doing what I'm telling you to do? And of course you don't have to because it's marketing. It's just, but what's getting in the way? And is there resistance? Is there some kind of trauma or schema? Or, some people that I worked with grew up in poverty and just felt like they were completely out of their depth when it came to anything business or money related. They felt like they didn't deserve it, or it had a really bad feeling to them. That's just one example. But as a mentor and a supervisor, I didn't just say, well, figure it out with yourself or go to therapy. And, I would say, talk with your therapist, but I would also get, really close with these folks and get my hands dirty, so to speak, and really try and put myself into it. I would think about the supervisee later. So I think that's that would really solve a lot of problems. It would solve the problem of these early career therapists not being very successsul and not knowing where to turn. Because another thing is that a lot of early career therapists will believe that they should be earning $200,000 a year right after graduation. So they've been misled. In fact, Paul David, my mentor, he, at interviewing me to get into the program, I wasn't even in school yet. I was just interviewing to get in. And half the time, because I was coming from business and he knew that, I told him that. I was, in market research and I had an office. I wasn't earning that much money, but in all likelihood, if I kept to that career, I would make a lot more money, not like a lot, but tech world, because the market research, it was in Bellevue, which is near Redmond and Kirkland, where Microsoft and it was in the 90s, so it was when all those companies were exploding and there was a lot of money and activity. And I worked for a market research firm, and it was sort of my beat, the tech side of the contracts. And so I worked with Microsoft a lot. I've talked about this before, but I was heavily involved in the marketing for Windows 95, if you remember. This is the version of Windows in which was made famous by these events, these live events that Bill Gates and I can't remember his name, the CEO of Microsoft at the time, and they would do these live events, and there'd be loud music and lasers and smoke machines, and they're really trying to hype up Windows 95. And it's kind of a weird thing to think about, that an operating system version would have like a tour, like a band would have a tour, like we're going to tour the unveiling of Windows 95. I mean, what the hell? But operating systems were a big deal back then. I remember that. Anyway, and they were doing this on stage, and if you just Google it, there's all these really good, you see these and God bless them, they're probably nice people, but you have these southern pasty white, frumpy looking nerds dad types that are trying to dance to this music and trying to hype the room for Windows 95. I think it's the CEO. He's like spinning his arms. Anyway, I was heavily involved in that. One of the tasks that I was involved with was I was surveying all the participants about their experience and if it increased their likelihood of buying Windows 95 or blah, blah, blah. And anyway, so I'm being interviewed at Antioch by Paul David. It's the first time or second time I'd met him, because the first time I met him was at a open house, and he gave a speech that convinced me to become a marriage and family therapist. I didn't even know about the profession. The second time I met him was this interview, and half the time he's just telling me like, look, you're not going to make very much money when you get out of graduate school. You might actually never make as much money in this profession as you likely would have made in the business and the trajectory you were on. And he didn't just stop there. He kept doubling down. He just kept telling me over and over again so that I made an informed choice. So that's what mentorship can do. It can put into perspective these folks, these early career therapists that are just like, I'm not making enough money. I'd say like, well, who the hell is mentoring you? Who the hell is working with you? And why did they not tell you that? I think there also should be some case law, and I think it's increasing regarding just life coaching in general, because I think that there's a lot of harm happening, and just because it's unregulated doesn't mean that there isn't a problem occurring. And I know I'm not an expert in this area, but I know this is already established, but I feel like it needs to be more established, and I feel it needs to be more advertised to clients and to therapists and coaches, that if a coach were to cross a line with a client and dip into clinical material that could be demonstrated as clinical material, then you're liable. Even though you're, as a life coach, say you have a life coach that isn't even a therapist, they're just a life coach, that there would be a precedent, and that it would be well known, not only to the consumer, but to the life coach, that, if you cross that line, there could be major consequences. And I feel like that, because it's kind of the Wild West, that hasn't really been established yet, because there hasn't been enough case law, enough people suing people. And also, I don't think clients are being informed, because, of course, there's no obligation from the life coach to inform the consumer about their rights. For us as therapists, it is somewhat illegal, but more of an ethical responsibility that we actually inform our clients about their rights, about what to expect. We can't advertise, we can't false advertise, we can't make false claims without incurring consequences. And we also have to tell the client who they can complain to. We have to give them the address and email address or contact information of our state licensing board. Say, if you have a complaint, here is who you talk to. I mean, there's not a lot of businesses that in the very beginning of providing a service tell you who to complain to, right? Whereas a life coach, there's who they're going to call. There's nobody. And also, a lot of life coaches, anecdotally, a percentage anyway, claim some bullshit about how perfect their help is and the sort of things that they can do to help people. And they can also force people or influence people to write positive reviews about them. Therapists are not supposed to do that. We've been trained not to. You can complain to the licensing board if you ever do have a therapist that does this, and that therapist should be reprimanded and sanctioned in some way. And so I guess that would be another thing, another solution to this, is just making into law or case law a very clear line between coaching and therapy that I just do not think exists today. Now, some of you might be thinking, well, Kirk, why do you even care about this? Like, what's the problem here? And is it really all that bad? I mean, who really cares? Well, I worry about clients being harmed, and it's happening. It's happening in this case that I'm about to elucidate. It's happening all the time. Now, therapists can harm their clients too, even though therapists have been trained and they've been regulated, and they are regulated. So it's not like therapists can't harm people. But when you have an unregulated and to some extent unmonitored, unresearched profession like coaching, then it's hard to know how much harm is happening. But of course, we have to imagine that, there's a lot of people being harmed. And I'll give the caveat, there's plenty of coaches that are absolutely not harming their clients. But, it's not hard to imagine that there's a lot of clients of coaches that are being harmed, because you can literally be anything and you could be an 18-year-old high school dropout that says you're a life coach, and if you market yourself well enough, you're going to get clients. Or you could be someone who is involved in a lot of crime. I don't know. I'm just trying to think of other. And that's not typical to the situation, but All right. So I worry about clients being harmed. Let's talk about that for a bit. So non-therapist life coaches, so just regular coaches, can harm clients because they may or may not have any training. The training that they got might not be sufficient. There's no oversight necessarily, right? In fact, I would take a guess and say that the vast, vast majority of life coaches have no supervision and no oversight. And I'm here to tell you that therapists, helpers in this arena, if we call life coaches kind of in this arena, early career for the first number of years, they need a lot of oversight. In fact, clinicians know this, but if you don't know this, let me tell you that for most of the professions, your early career, by law, you have to be supervised greatly. Like in my profession, marriage and family therapy, you for the first 2 years at least, you have to have weekly supervision. Actually, I think it's twice a week, right? So, or no, I think it's weekly. Yeah, weekly. Anyway, point is that you need a lot of supervision. And this is, supervision is intense. When I have a supervisee, I meet with them once a week for an hour. You get to know each other pretty well, and you talk about a lot of things. There's, it's an hour a week. It's a lot you can get into. So you have these life coaches that have zero training and zero oversight, zero supervision. No one is taking a look at their competence, their practice, what they're doing, the assumptions they're operating from. They're just, these life coaches can be completely just on their own. They just woke up one day and said they were a life coach. So to expect that these individuals would have any sort of, again, if we educated the public sufficiently, then that's not a problem. I'm not saying that you can't be a life coach, but I don't think that the public is educated properly. And like I said earlier, even if they were educated properly, people still don't necessarily know what they don't know. Also, disclosures. Us therapists have to disclose a number of things to our clients up front that life coaches have no responsibility for that. Also, advertising, I've been over that, that we have ethical codes about. It's not common that you would find a therapist that would make a ridiculous claim online about their abilities and what they can do. There are some, but it's not very frequent. Whereas when I look at life coaches in general, their advertising materials, it's ridiculous. It's stuff like people, if you've been watching the Twin Flames documentary with me on YouTube, you know that any charismatic person who has some sort of narcissistic problem or psychopathic problem can claim to be a life coach and convince people of their magical powers to, cure anything. You know what I mean? So there's a greater likelihood of a life coach having that problem. And that's not, anyway. Okay. Well, so just to kind of provide one more point here, and then I'll get back to the case, is that from the beginning, I haven't really been able to put into the words until I was prepping for this episode, that I worry about our profession becoming diluted. And let me explain. That when we have this blurring of lines between therapy and coaching, which isn't on paper supposed to be happening, but absolutely is happening, particularly when you have therapists that are also coaches, legitimizing the coaching profession. And again, coaching is a legitimate profession if it's kept within a certain boundary. But I cannot say that coaching is a legitimate, safe practice. If someone came to me and said, I have a problem, I'm going to seek a coach. Do you think that's a good idea? I would say, whoa, like you would have to do so much homework to figure out if it's right for you and if this professional is not likely to harm you. Like there's a lot that has to go into that. So in that way, I would not call life coaching as, the people that adhere to that label, because we include everyone, not just the legitimate people, but we include everyone that has that label. I would not say that it's a legitimate profession. And so when we as therapists, who are a legitimate profession and have worked very hard, talk therapists in general, psychotherapists in general, psychology professionals, mental health professionals in general, since Freud spent most of his career trying to legitimize basically what we all do, and he succeeded. And then subsequently, all sorts of people, including us today, and me included, have been trying to spread the word about the legitimacy of our profession and how we can help people. And we've worked really hard for that. And so for us to just associate ourselves to some extent with life coaches and allow that association to happen willy-nilly, then I think it invites this association that I don't think is good for our field. Like I said, in the future, I'm pretty sure life coaches will become a legitimate profession in my eyes, and that they will become regulated and formalized regarding training and boundaries. But as of today, that is just not the case. That worries me, that there are people on TikTok that are following coaches and early career therapists that don't know what they're talking about yet, but are more interested in being an influencer than they are in helping people. They're just being inundated with all this information, and there's a lot of people out there that are just like, well, life coaches, therapy, what's the difference? In fact, there's a lot of people that will say, I'll hear this, that coaches are better than therapists regarding clinical matters. There'll be people that will say, oh, I was going through a really rough time and my mom died and I lost my job and I found this coach and, they completely turned my life around. Whereas I'd been to a therapist before and that therapist was worthless. Now, that individual, I don't doubt their story. And there's nothing wrong with that story. There could be something wrong if we looked into the life coaching scope, what the life coaching was getting into. But in terms of that consumer, I don't fault them at all for that. When someone says they had a bad experience in therapy, then I tend to agree that because it does happen. And when someone says they had a great experience, a life-changing experience in coaching, I tend to believe that too. That does happen. And those are cases that are good. And I'm happy that happens. But there are so many other situations where it's not that way. And for us to be associated with that, I just think it's a problem. And so I think for us, as mental health clinicians, we should be educated on how to talk about this problem. Because one of the things that I see a lot of clinicians doing, because there are a lot of people that think like me. If you're a clinician listening, there's a good likelihood you already thought like the way I do. And either you've had a fair amount of education or discussions around this, but in all likelihood, you probably haven't. And so you probably just have a general discomfort with life coaching, but you don't really know how to articulate why you feel uncomfortable. And so I think we have to be better about that and be very clear to people and effective at communicating to people online, in person, to our students and supervisees. There's a lot of novice therapists that are listening to us, and we influence them. And so I think we have to have an ability to articulate to them what's going on. And so I think that I worry, because the other thing is that I'm old enough to remember when my profession and other professions in mental health were not really legitimate professions. In fact, for a long time, and I don't know the exact history on this, so take what I'm saying with a grain of salt, but when I started as a therapist, they only had this thing called registered counselors. And where do I begin with this? Okay, so this is a very brief discussion of the history of mental health in my field. You had psychiatry, you had medical doctors like Freud and others who also provided mental health services or solely provided mental health services, but they were medically trained like any other doctor, any other physician. Then you had this other group of people that emerged called psychologists, and these were doctoral level individuals who also provided mental health services. At some point, there was this movement to increase the number of mental health in people and also make the career a little bit more accessible by not requiring a doctorate, by saying, well, we can teach you enough things in a master's degree. I'm only 95% sure that this is all accurate in general. So take what I'm saying with a grain of salt. And so for a good amount of time, you had this unregulated bunch of so-called clinicians who were master's level educated, and they called themselves counselors or therapists. I think marriage and family therapy was this way as well. But there was no education requirement. It was the same as coaching. Anyone could call themselves a therapist. They could have no education, or they could have a lot of education. So you had people providing therapy or counseling and hanging a shingle and charging money who had zero education and training and oversight, and you had others that had a lot. They had a master's degree and all the things. Then us master's level people, because I was a master's level person before I got my doctorate, but before I got my master's, there was a lot of advocacy to actually professionalize our field and to tell the government, hey, we need you to start regulating us. And, it's a collaborative effort to create the profession and the licensure and the requirements and blah, 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 accreditation, DDD. So I remember a time when we were like coaches and we were legitimately attacked by psychiatry and psychology as being a bunk field, as being a bunch of idiots that don't necessarily know what they're doing. Or at least there's a percentage of these registered counselors, because that was the designation, was that you just had to register as a counselor. So eventually the state of Washington anyway added this registered counseling designation for master's level people. And all you had to do was take, I think you had to watch like an hour video about HIV and AIDS, and then you paid $40. I did this actually when I was first entering the field. And then you were a registered counselor. That was it. And the reason why they had that was because then there could be a recourse by the public to take away your registration so that you could no longer be a counselor. But you didn't have to have any education or anything. Anyway, so I remember a time when we were basically an illegitimate field, illegitimate profession. And I worry that we could return at least partially back. There's a lot of benefits when we and the public are very, and the public knows that we're very firm about our boundaries, and we're very professional, and we're very buttoned up, and we have a lot of self-policing and a lot of self-policing regarding ethical codes and training and care. Like when I was providing mentorship and spending a lot of my blood, sweat, and tears to help my mentees, I wasn't being paid for that extra work. I did it because I wanted to, because it meant something to me. And that's a special thing. We're not in it just for the money. I mean, it is a career. We do get into it because we want to pay our bills, but we're in it because we want to make the world a better place. And we benefit by being that way and by attracting people along those lines and by advertising ourselves as such, and for the public to see us this way and for us to actually back up what we're saying. Whereas, I'm telling you, in the past, that's not how the public necessarily saw us. They would talk to a psychiatrist about going to see a master's level clinician, and that psychiatrist would say all the same things that I'm telling you about the coaching field, and they would be right to say so. So it's important that we hold the line. It doesn't mean that we just completely reject coaching, but we have to be very fucking careful when we just start flirting with that line and we start flirting with this other profession, because they could bring us down. We could retain licensure and all that other stuff, but we could, to the public's eyes, we could become associated with that and considered that. And there's enough people that already think that we're a bunch of idiots or we're a scam or something. And it wouldn't be good. I worry about that. Okay. So this is turning out to be one of the longest episodes I've ever recorded, or in a while anyway. Okay. So let's get back to the case. The client, I probably forgot everything. So you have this licensed professional counselor, private practice. He starts treating a male in his mid-20s, homeless, unemployed, criminal history of substance use. He's court ordered. And the the counselor says, okay, I'm going to do counseling and I'm going to do life coaching. So he's one of those people that does this. Not that that's necessarily a bad thing, but let's continue reading. So the client apparently relied on his parents financially because he didn't have a job. And so the parents were paying for the therapy and the life coaching and for the client's rent and everything like that. And so when the counselor figured that out, the counselor recommended that the counselor would control all of the client's money, including all the money that the parents were giving to their kid, their adult child. So all the money for rent and food and car payment or whatever, the counselor says, I want you parents to give me all that money, and then I will pay my client's bills. And this was all presumably underneath his life coaching umbrella. So again, the counselor is saying, I'm providing therapy to this client and life coaching. And so when he says life coaching, he's like, well, then all bets are off. I can do anything. I can even take over the finances of this person. Now, it's possible that the counselor was not trying to commit fraud and that the counselor, there was no evidence of that. I'll just, spoiler alert on that. But that doesn't matter, because if you're providing therapy to somebody and you're also, but let me go on with this. All right. So the counselor says, I want to control all the client's money, and also there will be no contact between the client and the parents. I don't know why the counselor was doing this, but that's what the counselor decided. And the counselor had the parents sign a contract stating that the counselor would be paid up front for counseling services and life coaching services. So it'd be like this lump sum up front. And the counselor would be reimbursed for the client's living expenses, including food, clothing, cell phone bill, and rent. And so the counselor would be paying all those bills and then reimbursed. And the parents did sign that contract. So this gets back to what I was talking about earlier in terms of it's often the tip of the iceberg. When I hear about a therapist/counselor, it often will be found, not all the time, of course, but at least anecdotally, will be found by me that there's a lot of bullshittery that's occurring that you wouldn't know about because you weren't close enough to the situation. So this is a shit ton of bullshittery that's happening. Sometimes I say a sentence and I'm like, I wonder if that's the very first time that sentence has ever been said. There's a shit ton of bullshittery happening. So therapy and coaching began. The parents, of course, gave a shit ton of money to the counselor because it was upfront, right? The counselor paid the bills, and treatment continued for months. I don't know how treatment went, but they didn't go into that. The counselor hired the. Okay, so here's another detail. The counselor hired the client to perform landscaping work at the counselor's home. So remember the tip of the iceberg thing? Now, eventually, the client's parole officer, because remember, court ordered, the client, his parole officer, eventually became aware after months of what was going on between this therapist and client. And the officer knew enough to say there's something wrong there. And so the parole officer filed a complaint against the counselor with the Department of Licensing. And the licensing board opened an investigation. The board, hired an expert to look into the situation, and the expert looked into the situation and concluded that the counselor was negligent in treating this client. That's a legal or a licensing term, negligent. In that, at least I believe what this means is that the counselor didn't necessarily harm the client, but the counselor risked great harm by neglecting ethical standards. So the expert pointed out that, contrary to what this counselor did, that life coaching should only be used with clients who are free from acute psychological distress. And apparently that was not done, meaning that regardless of whether or not the life coach is a therapist or not, a client who is going through significant psychological distress should not be just in coaching or coaching at all. And the psychological distress that this client was under was, depression, sounds like substance use, antisocial personality disorder. I mean, I wonder how that played a role. Another thing that the expert said was the counselor failed to demonstrate an understanding of the difference between counseling and life coaching, which is clear. Also, the counselor violated ethical codes by bartering services with the client. Now, the counselor tried to explain and said, hey, look, when I was engaging in the bartering agreements with this client and other clients that this counselor was doing it with, he did so with the client's best interests in mind. Like I'm guessing what the counselor said was, look, I could have hired anyone to do my landscaping. I didn't need my client to do it. I could have hired someone else, but my client really, really needed a job and was struggling with finding one, and because of his criminal record was having a hard time qualifying for one. And also he was kind of scared of working at other jobs because he was in early sobriety, and there's a lot of drugs in the world and a lot of people using various substances. And he worried that if he just got a random job that, he might run into other people using, and, that's a huge risk. And so it was a win-win for him to be, not a win-win. It was a win for the client and not for me to hire my client as a landscaper because he wouldn't have any employees that would tempt him. I could help him. I could reassure him that he's doing a good job, so we could talk about how it was when he was working in session. There's a lot of benefits to that. I'm guessing that's what the counselor said. And okay, yeah, I understand the justification, but to hire your client as your landscaper, and I won't say that can never be done. Maybe there are situations where that can be done as a therapist for the client's benefit. But the proof that you did what you needed to do in terms of assuring that the client wouldn't be harmed would be enormous. So you'd have to consult, you'd have to document, there would be all sorts of informed consent forms and discussions with the client regarding their rights. But it'd be hard to imagine, honestly. As I say it out loud, it'd be hard to imagine any situation that would convince me that it was worth the risk to hire a client to be your landscaper. I mean, maybe if a client just had years of a track record of being unable to secure employment and being unable to work with other people, and they just needed one controlled experience. But, you wouldn't have to hire the client to be a landscaper. You could just do like a mock work, where everyone knows that it's fake. But there was none of that, right? It was, even though the counselor is saying, look, I was doing this for the client's benefit. Okay, but you were also paying all of his bills, and I didn't include this, but he's also driving him around in places. He's basically like his big brother or something. I don't know. So yeah, it's kind of ridiculous. So as always with these ethical cases, or at least most of the time, the issue at hand, like how someone, a counselor, didn't know the difference between life coaching and therapy, that's just the tip of the iceberg. You got the bartering thing. You got the money thing. You have the driving the client around thing. You have the counselor believing, because the counselor is doing this in the open. There's no attempt to hide what's happening. The counselor is not secretly doing this. The counselor thinks this is okay. And that is just astounding. If you're a therapist or a student that's going to be a therapist, you totally understand that anything even close to this realm of behavior, your alarm bells would be going off so loud. I mean, I always use this example, but I always have students or early career therapists that will say like, oh my God, I had a client that offered me a gift and I didn't know what to do. So I felt bad, so I accepted the gift. Am I going to go to therapy jail? And I'll say like, no, let's look at it. Let's talk about it. There are considerations. And yes, you don't want to create a culture of expecting your clients to give you gifts, or a culture that encourages clients to believe that you're supposed to get gifts as a therapist, especially expensive gifts. There's ways around it. And sometimes in a pinch, you accept the gift and you improvise, and you're not going to go to therapy jail. for that. And there's always sort of something you could do later, like next session, you could say, hey, I talked with my supervisor and they said, I can't really accept this gift from you, but I just want to thank you so much for giving it to me. It's so thoughtful and I really appreciate that. But according to the policy of this agency, I can't accept it. There's things you can do later on. It's not like doing it in the moment would be this huge problem. But anyway, that's just accepting gifts. Way farther down the road is having the parent sign a contract where they can't have contact with their 25-year-old son, and then telling the parents to give you all the money, and then you paying all the bills, and you providing life coaching, and you hiring that client as your landscaper. Like the typical therapist, in my view, they're too paranoid about ethics. The average therapist that I know anyway, they're way paranoid about even getting close to the threshold. And so they limit themselves. Like another thing that I'll hear from people, not any of my students, because I disabuse them of this idea very quickly, is that self-disclosure is unethical. I'll hear that sometimes. Even people in my university will come from another class and they'll be like, yeah, self-disclosure is unethical. I'll be like, what the fuck? Like that is not what the research says. It's not the consensus. It's not in a single ethics book or therapy book. I would challenge anyone to find any legitimate clinical book that would say self-disclosure is unethical. It's not even a debated topic in our field. And yet there's a lot of people that believe that. And so, typically novice therapists are too restrictive and too paranoid. Now, can self-disclosure be unethical or be a problem? Yeah, but it's not inherently a problem. In the same way that talking to your client could be a problem, right? You might say stupid shit to your client, but the umbrella behavior of talking to your client is not a problem. You know what I'm saying? Anyway, so for someone like this counselor to go so far, but it's like tip of the iceberg. And this is, I see this a lot. And often I'm only seeing a little bit of the iceberg. I'll see someone who's a therapist and a life coach, and I'll only see like a little bit below the surface because I'm not an investigator and I'm not close enough to the situation. I'm only like, oh God, I see that. That's a red flag. I don't know if it's a problem. Then I learn a couple other things, or I hear a sort of way that they talk, and I'm like, uh-oh, that sounds like a bad thing. And I highly suspect that below the surface of the water, there's all sorts of stuff, just like what we're seeing here. All right. So what did the licensing board do? Because the expert found these things and the counselor didn't have any sort of defense against it because it was all right there and factual evidence that that's what was happening. So what did the licensing board do? Many of you might figure that, oh, well, obviously they took the license away, right? Or at the very least, some pretty heavy sanctions. Well, deserving listeners, let me tell you the consequence that they bestowed. It is probation for 90 days and a $500 fine and 8 hours of continuing education on ethics and professional boundaries. That's it. So probation for 90 days, which I believe just means that the counselor if the counselor committed another violation within those 90 days, then the counselor would be in extra trouble or something. Because probation doesn't mean you can't practice typically. I mean, maybe it did, but even if that were true, 90 days, that's it. But I'm 90% sure that probation for 90 days just means that, they're like, we're watching you for 90 days. And also a $500 fine. He was probably charging, God knows how much he was charging to this family because of how much time he was spending. Anyway. And then 8 hours of continuing ed on ethics. 8 hours. 8 hours. That's nothing. It's probably a day, 1 day class, maybe a day and a half of an ethics class. That's going to fix this problem because this is not only are we seeing below the water in terms of the iceberg, but God knows what he's doing with his other clients. That was not investigated because that wasn't the scope of the investigation, right? They're not going to troll through his records and find other clients and ask them, and current and past clients, has he done anything like this before, or what else has he done? What's the chance that this counselor, the entirety of his ethical violations occurred with one client? What is the chance of that? And yet, 8 hours of continuing ed. It's so disappointing. This happens all the time. To me, I think people like this should have their license stripped away and never be able to practice. This happens in the medical field too. I don't know what it is about licensing boards and state governments that are so afraid to provide consequences. Because to me, people like this are rare. They are exceedingly rare. We're talking, the people that are capable of all of these violations, we're probably talking 1 or 2% of the professionals in our field that are committing half of the harm to the public, as a whole. If you think of all the harm that our profession causes, this 1 or 2% is probably causing half or not more of the general harm. So what's the worry? I don't understand. What is the licensing board worried about? Because I'm sure they had this on the table. It's like, well, we could strip the license and never allow this person to practice. The other problem is that because we have different licensing, different licenses in different states, is that you can lose a license in one state and just get another license in another state. This happened with that shrink next door guy. What was his name? Hirschkoff, I believe, Dr. Hirschkoff. He was incredibly unethical with his client. They made a TV show with Will Ferrell and Paul Rudd. Great TV show series, Apple, I think. And this therapist was basically he did. Long story short, if you don't know the case, this therapist found a client that had a lot of money and was socially insecure, and this therapist proceeded to essentially take over all of his money and even his business. He wormed his way into his client's business and basically took that over too. He moved into this beautiful summer home of his clients and then made his client basically become his groundskeeper for him. And this went on for decades. This guy did lose his license in New York State, I believe, thank goodness, but he's just moved to another state and he's practicing there currently. So to put someone in prison for the rest of their life, that is a major alteration of freedom for an individual. To take away the ability for someone to practice medicine or psychotherapy in the United States anyway, it's not a huge deal. There are other professions, there are other jobs, like coaching, for example. There's a lot of, their life isn't over, and the people that would qualify for what I would consider the threshold of taking away their license, they're pretty rare. It would be and those individuals would have been given so many opportunities to do something different. I mean, all the education and all the opportunities for consultation and supervision. I mean, just Googling it. Let's put it this way. I don't think I know a single therapist that has ever had anything close to this kind of relationship with one of their clients, hiring them for anything like babysitting or landscaping or doing their taxes. I don't know a single person personally. I've only heard these stories through these ethical cases. So it's usually not necessary. There's usually another way. Even if, like I was saying earlier, even if it is a social justice issue, you can just not charge a client, right? Point is I just don't understand why licensing boards. I don't know the full scope, of course, but I have heard so many accounts. There's so many. It's so weird. Okay, so plenty of legitimate complaints are submitted to the government in the United States, and only a percentage of them are even investigated. I hear a lot of people will make a complaint and nothing will happen, including that Hirschkoff case, the shrink next door. There were several complaints over several years that were submitted to New York State. And for several years, I mean, we're talking 10, 15, 20 years or something, the state did nothing. I mean, I think they investigated kind of, but it essentially did nothing. And it was so obvious that, he was living in his client's nice house. He and his client were the executors of a charity fund that was solely funded by the client. And, and the list just goes on and on. Again, for decades, it was extensive. So if ever there was a case that was worth investigating, it was that one, and yet it didn't. So that happens. So, but even of the ones that get investigated, many of these cases end up being dismissed that shouldn't be. And even among the ones that end up being found by the licensing board that the counselor has acted in an unethical or unstandard way, in a problematic way, the punishments are often far below the mark. I was a listener, actually, to this podcast years and years ago, contacted me and sent me a lot of emails and documentation and whatnot about a case that she was involved in which her therapist had committed an ethical violation, a series of them. And you can listen to those episodes. I think I call them like a therapist kisses his client or something. And he was increasing his physical and sensual touching of his client increasingly over a number of sessions, to the point where the entirety of the session he was laying down on the couch with her and caressing her in a sexual way and kissing her body and telling her how beautiful she is and saying how attracted. I mean, it doesn't get any worse than that, right? He's laying on the couch in full double embrace and silently telling her how beautiful she is and how perfect she is and how much he likes her and da-da-da-da. And she would say that, she was being indoctrinated. She actually enjoyed it because, when you're getting that kind of attention, it feels good. But that's the thing about, it's similar to cult indoctrination. Cult members don't say to themselves that they're not enjoying being a cult. They think they're at the promised land because the manipulative leader is manipulating and making you feel like you're special and you're safe and this is good for you. Meanwhile, it's not, right? The trauma starts to be felt later, and that's what happened to her. Anyway, so and there's all documented, and the therapist, the counselor, did not refute any of the details that the client provided, or at the very least didn't have any evidence to refute it. And so it was basically just taken as fact that whatever all the client's allegations. And so there wasn't like a he said, she said thing. And the documentation, of course, was terrible. There was no consultation. There was no justification. There was no training, because you can have training in using touch and therapy. Obviously, this would not count, but at the very least, there is some training. He had never had any of that. I think he didn't even know the field existed. And he was an experienced therapist. He'd been a therapist for decades. And it goes to the licensing board. You just think, well, this is a slam dunk case. His license will be gone. I mean, he's a disgusting pervert that is a problem to society in general, let alone being a therapist. And I think they took his license away for a time, and then he got it back. Now, his sanctions were, pretty severe. He had to be supervised, but still, he gets his license back. And I'm thinking, do we need this person to have his license? Is that a necessity? Are there no other therapists in the area? What are we doing? Because even if someone could say, look, the risk is low, that they've learned their lesson, I'm like, well, I don't care. Like there's other jobs. Become a car salesman or work at the Starbucks. Like, we're not preventing you from working. You can work, but you've proven that you are not worthy of the mantle of this profession. And I also think that because a lot of times these licensing boards are made up of actual clinicians like us. And I think if, in a way, it's kind of self-policing, right? And so if we self-police in a very harsh way, I think that sends a message not only to other therapists to watch their shit, but also to the public to say, we take your care very, very seriously. And when one of us fucks up, we oust them and in no uncertain terms. They are gone. We don't have any tolerance for that kind of shit because, accepting a gift, no big deal. One of these ethical violations with one client, okay. But the amount of problems that we see with these people, I just think, you had your chance and you fucked it up and you're done. Get another job. There's a lot of other jobs out there, a lot of other careers, You could be a cabaret singer or a Christmas tree cutter downer. There's a lot of fucking jobs. And those other jobs do not carry with them the risk of harm to human life and psychology that this job does. So, hit the bricks. But this person gets 90 days probation, $500 fine, and 8 hours of continuing ed. It's we are required baseline to have about 8 hours of continuing ed on ethics every so often. That's normal. That's just par for the course. So this guy was just required to do a little bit more than typical of continuing ed. It's so bizarre. And if I were this client, the family that was harmed, I'd be so pissed off about it. Be like, what? Now, it's also possible that the family actually doesn't consider themselves to be harmed because they didn't mention that. It was the probation officer that reported him. So I guess I don't know what's going on there. But anyway. Well, that was a long-ass episode. Full disclosure, it is Christmas Eve right now, or as I like to call it, Rebecca's birthday Eve. And I don't know, I guess I'm just in the mood to yammer. It's also been a while since I did just a random individual solo episode, and maybe I had a lot of pent-up energy around talking. I used to do this a lot more, but now with all my co-hosts, I feel like it's just not I don't have any time slots for me to just do my own episodes, So that must be what it is. Also, I'm pretty passionate about this, and I've talked about this over the years, but I feel like I've never really fully gotten into it. And I think I had a lot of pent-up energy around this. I'm positive that some of you are pissed off at me about this whole thing, or not positive, but I suspect. And I'm willing to have my mind changed. You don't have to be a dick if you're contacting me or commenting below. You could say, hey, Kirk, I agree with this. I disagree with this. You don't even have to be particularly. In fact, I'm much more likely to be convinced if you're not a dick. If you're just like, hey, in my experience or something like that. But if you're a dick, then I'm at the point now where I don't even read the rest of the email. If I see dickishness, I'm just like, yep, I'm done. So I guess if you're a dick, be a dick at the end of the email. That I'm more likely to at least entertain the thing. But I am curious, because this is not only coaching is not only is it an unregulated field, but the discussion around this is also not super buttoned up. I in graduate school and in professional circles, I don't hear a lot of sophisticated talk among therapists about coaches. There's not a lot of a consensus or discourse to have us therapists have a sophisticated take and to understand, other than, maybe just like, I don't know about this, but I don't really know much more. I suspect in the future it'll be a lot different, and maybe some of you live in these circles, I imagine some grad schools go into this quite extensively, at least I hope they do. And so I'd be curious as to your experience. But from my experience, it's almost never talked about. And the only things that I hear are either just like, I don't know, seems a little shady to be a therapist and a life coach, but that's as far as it goes. Or people are just life coaches and therapists, and they're just like, yeah, I became a life coach as well because, some of my clients, they just want that kind of thing. And there's not really any more discussion around it. So, yeah. All right. Well, take care of yourself, truly. Stay ethical because you deserve it. You really, really do.